Voy a presentar ahora a alguien que ustedes ya conocen, porque lo vieron hace un rato interactuar. Aparte, son generosos porque no se han subido al...
During the 70s, cannabis was considered as a Schedule I drug, like heroin and cocaine, and it was never been approved for both medical use or for research purposes. And this time is very, very important in our perspective of cannabis field and cannabis research, because during the same time, during the 60s and 80s, a young scientist started at the Weizmann Institute and later on moved on to the Hebrew University, I mean Professor Raphael Meshulam, discovered the active component of marijuana, cannabis. He identified the psychoactive component, THC, and the non-psychoactive compound of the plant, CBD. You can see here that the ratio between the THC and CBD basically represent different types of strains for cannabis. Now, he not only discovered the fact that this plant contains these two active components, he was also identified different cannabinoids in the plant, for example, CBG, CBL, CBN, and CBC. Now, you understand that these compounds and these initial discoveries made in the 60s did bring a lot of interest. But it took only, I would say, 20 years after this initial discovery to actually identify the binding site for THC in the brain. So, 20 years after, indeed, the cannabinoid receptors have been identified, CB1 and CB2. These are receptors share 44 similarity between the two, and they are present all over our body, as you can see. These are G-protein coupled receptor, and in fact, CB1 is the most abundant G-protein coupled receptor in the human brain. You can find CB1 mainly in the nervous system, but also in peripheral organs, as you can see here, testes, eye, vascular endothelium, spleen, adipocyte, liver, and so on. Now, CB2 receptor that was found a few years after CB1 is mainly the peripheral receptor. It was mainly focused on cells that are related to the immune system, such as B cell, T cell, macrophages, lymphocytes, but also in the brain under certain pathological conditions. Now, these receptors are present in our human body not because they are waiting for us to use cannabis, and you probably need to understand this, because these receptors probably are being activated by different compounds that our body basically produced. And indeed, this question was raised by Professor Meshulam back then in the 90s, and he did identify the two endocannabinoids identified so far, anandamide and 2-AG. These compounds are called endocannabinoids. And these endocannabinoids can basically produce by any cell type in our body. They are derivative of arachidonic acid, so basically you can find it in any type of cells. They are being produced mainly on demand when the body needs them, and they activate the cannabinoid receptors in a retrograde signaling pathway, and I will touch base on it later on during my presentation. And they immediately metabolized. So let's look more specifically on these two endocannabinoids, anandamide and 2-AG. So anandamide here on the left, you can see it is mainly generated by phospholipase D, one enzyme that is present in the cells, to generate anandamide, and then by using a different enzyme, fatty acid amide hydrolase, or FA, it can be degraded to do different compounds, to ethanolamine and arachidonic acid. On the other hand, 2-AG here on the right is being generated by a specific enzyme in our body that is called diacylglycerol lipase, or DAG lipase, and is being degraded also to arachidonic acid and glycerol by monoacylglycerol lipase, or MAG lipase. So you can see that you can amend or modulate endocannabinoid production or degradation by affecting their synthesis or degradation pathways, by specifically point to the enzymes that are mainly produce them or degrade them. Now, how endocannabinoids such as 2-AG and anandamide and also THC work in our body, or mainly in the brain, I would say. So first of all, endocannabinoids can be produced by the postsynaptic cells. Once they are generated, they can travel in the synapse in the brain to the presynaptic neurons to activate the CB1 receptor, which I said that it was present there in large quantities. Once activating CB1 receptor, either by endocannabinoids or by THC, they basically can reduce calcium influx and inhibit the release of different neurotransmitters, norepinephrine, dopamine, serotonin. So in fact, these endocannabinoids activation in the brain can modulate synaptic activity and can influence different normal and pathological conditions that are controlled by the brain. On the other hand, using of cannabis or endocannabinoids can modulate different physiological effects. For example, synaptic plasticity. It has some orexigenic effect, and I will tell you about this later on tomorrow. Analgesic effect, reward effects on drug and alcohol, neuroprotection, anti-nausea, motor and seizures, hypotension, sleep induction, bone remodeling, hepatic fibrosis, inflammation, and cancer development. And to be frank with you, these effects, or this list, is far from complete. The cannabis or endocannabinoids basically can modulate many, many physiological effects. So let's see what happened in the central nervous system. How can we manipulate different normal conditions and pathological conditions by cannabinoids or endocannabinoids? So because CB1 is mainly present in the brain, it affects different brain-related effects. For example, if you activate the CB1 receptor in the hypothalamus, you can increase appetite, and I will say a lot about it tomorrow. If you activate the endocannabinoid system in the brain stem, you can relieve nausea, lower blood pressure, and lower pain, spasticity, and tremors. If you do the same in the cerebral cortex, you can change disorientation, memory impairment, and cause hallucinations. At a hippocampus, you can control memory and induced memory impairment. At the cerebellum, you can lose coordination. And if you activate the endocannabinoid system or the CB1 receptor in the amygdala, you can cause changes in anxiety, panic attacks, lower traumatic memories, and decrease hostility. So all of these effects basically can be mimicked by THC that is consumed by people from the plant, but could also be modulated by anandamide and 2-AG, which are generated in our body and activate the CB1 receptor. And these are the central effects. What are about the peripheral effects of cannabinoids? So in peripheral effects of cannabinoids, and I would like to focus more on the CB1 rather than to the CB2 receptor. CB2 is mainly affecting different immune cells and immune response. But CB1 and the role in peripheral organs has been known only for the past 10 or 15 years. We know that CB1 receptor and endocannabinoids are present in different organs in our body below the brain. For example, in the gastrointestinal tract, in the pancreas, in the muscle, liver, and adipose tissue. And tomorrow, I will tell you more about modulating this system in peripheral organs. So when we think about the theoretical use of cannabinoids, we need to think whether we would like to stimulate it to get therapeutic effect, or we need to block it. It's not always that we need to use medical cannabis or activating the cannabinoid system to get beneficial effects. Sometimes we need to reach the opposite. But we also need to consider the fact that these effects are receptor mediated, either by CB1 or CB2. But the plant has other different compounds that you can actually generate different physiological effects through non-receptor mediated pathways, because the plant consists not only THC. I already highlighted the role of CBD, but in addition to CBD, there are different cannabinoids molecules that are present in our plant, in the cannabis plant, like CBC, CBG, CBDV, and you can see that if you use these different compounds, you can cause different physiological effects, both under normal conditions and pathological conditions. And we have also to remember that in cannabis, we don't only have cannabinoids. So we have cannabinoids here in orange, but we have also terpenes and flavonoids. In fact, we have over 1,400 different compounds in the plant that were identified until now. So, is it only THC or CBD? Or are we talking about a whole new plant, or not that new, actually an old plant, but a whole new different compounds that have been identified and also can generate different effects? So we called it the entourage effect, the familia effect. Because all of these compounds together can cause something that, if you isolate the specific activity of the different compounds, you sometimes lose the effect of cannabis. For example, if we take only CBD, we found out that it doesn't activate different physiological effects, but if we take the entire plant, then we can get the same effect that we would like to achieve. So we need to consider whether we would like to work on specifically on only 2 different compounds or 6 different compounds, or see the entire entourage effect of the entire plant. When we talk about cannabis, we have to consider that it is a drug, firstly. And as a drug, as like aspirin or antibiotic, it has acute and chronic adverse effects. So what are the acute effects of using cannabis? And when you think about it as a therapeutic point of view, you need to consider that patients that will take medical cannabis for treating their illness will consume a lot of cannabinoids. And therefore, we will have to consider these side effects. So the acute side effects are mainly related to anxiety, to tachycardia, sweating, decreased coordination, and dizziness and red eyes. But what about the chronic adverse effect of using cannabis? These are mainly related to dependence and withdrawals effects, to cannabinoid psychosis, which is a huge problem, to impaired education in adolescence, cognitive impairment, and cannabis gateway. In fact, cannabis has been shown to, if you use it under chronic condition for a long time, it can open your ability to use other different drugs, such as heroin and cocaine. Now, so we really need to monitor it very carefully when we prescribe it to patients. And if I'm talking about the chronic adverse effects, I need to also highlight the fact of the addictive rates of cannabis. But as you can see, only 1 out of 11 patients who will use cannabis will become finally addicted. It's only 9% of the patients. Okay, so it's not that big if you compare it to alcohol, heroin, and tobacco. And today, Rami Yaka will tell you more about the effect of addictions and cannabinoids. So, in the past few months, the National Academy of Sciences in the United States have actually reviewed almost around 10,000 different publications on the effects of cannabis and endocannabinoids, and came up with this huge review, contains around 400 pages, that basically summarizes for what indication and for what clinical indication the use of cannabis or cannabinoids or endocannabinoids has been found to be beneficial, and in what aspect there is no evidence. They reviewed many papers and manuscripts and looked for an evidence-based research that was done in the field. And I've read this entire booklet, and I came here to say to you a few words about their conclusions. So, in fact, there is a conclusive evidence that cannabis or cannabinoids are effective for treating chronic pain, chemotherapy-induced nausea and vomiting, and multiple sclerosis spasticity symptoms. These are the only 3 indications, according to the National Academy of Sciences in the United States, that highlight the therapeutic beneficial effect of cannabinoids. Actually, there is a moderate evidence that cannabis can help sleep disturbances. And there is limited evidence that cannabis and cannabinoids are good for increased appetite in HIV patients, multiple sclerosis, Tourette syndrome, anxiety symptoms, post-traumatic stress syndrome, and traumatic brain injury, which you hear more about it from Professor Esther Shohami later on. And there is no evidence, completely no evidence or conclusive evidence that cannabis or cannabinoids are effective for cancer, for addiction, for anorexia, for IBD, epilepsy, spasticity, Huntington disease, dystonia, and Parkinson's disease. So why the hell I flew more than 22 hours just to come here and tell you, well, there are only 3 indications that cannabis is good for. And all the rest is just, I would say, the B-word bullshit. It's not. Because their conclusions also was that you need to invest in research. You need to invest in research in order to expand the different possibilities of the plant. And to do so, we need funding. We need to acquire funding to promote research in that direction. And not only funding and research, we will need to develop an evidence-based medicine in order to know for what clinical indication medical cannabis is good and for what it doesn't do good and it doesn't do better. And based on this vision, we decided at the Hebrew University of Jerusalem in Israel, and with the vision of Professor Meshulam and the past 50 years of research that has been done by him, but also by other scientists, and I will show you that in a moment, to establish the Multidisciplinary Center on Cannabinoid Research. You can read more about the center in this website and the different aspects, but I will briefly describe you the different perspective of this center. So first and foremost, we are trying to stimulate and coordinate interdisciplinary research ideas and projects between many different scientists. It's not helpful that I, in my laboratory, working on a very specific and narrow indication. The communication between different scientists from different areas should be promoted. And this is exactly what the center does. It promotes the research, it gives funding for this research to be done, and move on. We are training the next generation of scientists, educate students, educate pharmacists, medical doctors, other health practitioners, because as I was educated 17 years ago about the fact that cannabis or endocannabinoid system could be modulated to different type of diseases, we need to disseminate the same knowledge to others, to the young generation, to medical doctors that don't know anything about this system when they learn in medical school. As I showed you, this is a major system in our body, like other hormonal and neuronal pathways. The next objective is to arranging an annual symposium on cannabinoids in Israel. Every year we do it annually, and in 2021 we are going to host in Jerusalem the International Cannabinoid Research Society. We are going to cultivate close interactions between different research institutions, both in Israel and abroad. And one part of this initiative is to come here to Argentina to look for those who are interested, scientists, doctors, to collaborate with us in order to expand our knowledge in this field. And last but not least, the objective of the center is to try to translate our knowledge also to commercial value, generating new IP, new compounds, new methodologies in the field that will take on by different companies and promote human health. The research that is done in the center is divided to 5 different disciplines, from agriculture to chemistry, pharmacy, pharmacology, and clinical development. In the agriculture part of the research area, we are working on trying to understand the genetic background of the plant. It's not only cannabis in general. You can manipulate it genetically, the plant, and produce different strains with different capabilities, with different amount of cannabinoids, terpenes, and flavonoids, and we're working toward this. We are trying to check whether we can improve the cultivation of the plant. The chemistry aspect involves better extraction of the different compounds inside the plant. We are going to do the chemical analysis and try to identify the different component of the cannabis plant, and also generate synthetic different novel compounds that could be then promoted to become drugs that would be used to treat patients. At the pharmacy area, we are going to do research that is mainly related on drug delivery. As you may know, using cannabis by just orally, it's not that beneficial because it does not absorb well in the gastrointestinal tract. You need to inhale it. But using different methodologies and nanomedicine to manipulate and to get a better efficacy of the drug by absorbing it much more efficiently, then you can able and promote the development of a specific pill that could be taken up by the patient and become more and more closer to other drugs that are present nowadays. We are working and asking questions about the pharmacokinetics and pharmacodynamics. In the pharmacology aspect of the research, we are working on the mechanism of action, MOA. How does cannabis actually works and manipulate so many organs in our body, so many pathways? Can we identify new molecular pathways that are being modulated by cannabinoids? This is one research area specifically that we are working on. And last but not least, it's the clinical development aspect of the research, because we are working also with doctors at the medical school that prescribing medical cannabis to their patients, so we can get information back to see what strain better for each and different indication. We can identify endocannabinoids as novel biomarkers for different types of disease. And I will show you some example for this tomorrow. The research involves many clinical indications. We are working on pain, epilepsy, epigenetics, development, neuroscience, addiction, allergy, microorganism, nanomedicine, metabolic disease, just to name a few. And the research is being done not only by myself or the distinguished professors that came here. It is being done by 30 different scientists located in 6 different faculties and institutions at the Hebrew University, from the Institute for Drug Research, the School of Medicine, Hadassah Medical Center, the Faculty of Agriculture, Faculty of Dentistry, the Silverman Institute for Life Science, and Institute of Chemistry. And each of these scientists is working not only by himself, but in a stimulated and coordination with other scientists in the center. At least we believe to do it and promote it in the center. So you heard today, unfortunately, Professor Meshulam could not be presently here and deliver his talk, but you heard a lot of his work that has been done in the past 50 years and so on. Rafi Meshulam is still actively involved in research. He comes every day to his lab, conducting research, developing new molecule, developing new extraction procedures. So I hope that by the time that I will reach his age, I will be that active. Apart from Professor Rafi Meshulam, we have here Professor Esther Shohami, who is the head of the Neurotrauma Lab. And Professor Esther Shohami research is focused on the experimental traumatic brain injury in rodents and trying to address mechanisms of injury and endogenous neuroprotection with special emphasis on the endocannabinoid system. In her talk after lunch, she will discuss the different pathophysiological effects that are involved in traumatic brain injury, such as cerebral ischemia, the glutamate release, increased calcium influx, neuroinflammation, and brain edema. All these effects contributing to the secondary effect of the brain injury, and she will show you how you can manipulate either the plant or use the plant or manipulate the endocannabinoid system in order to get therapeutic benefits to treat traumatic brain injury. Next, Professor Rami Yaka is also here with us. He is the head of Lab of Addiction and Neuroscience, and his work is trying to understand the molecular mechanisms that underlie drug addiction such as cocaine and cannabis, and develop new therapeutic to prevent it. As you may know or may not, the drug addiction consists 3 different stages, starting from the acute use of the drug to the social and compulsive use part, and then during the withdrawal effect of the social and compulsive aspect of drug addiction, there is increase in the capability of relapse. And we still don't know exactly what triggers the relapse for cannabis addiction. And he will briefly and more thoroughly describe to you the role of endocannabinoids and the use of the plant to modulate this specific activity. Dr. Ofra Beni, who could not do the travel due to personal issue, will deliver a talk tomorrow through a web seminar. And she is the head of the lab of nanomedicine and tumor microenvironment. Her research is to try to develop a drug and drug delivery system for cannabinoids to treat cancer. And more specifically, she will show you how important it is to target the blood vessels that are surrounding tumors, because this, without blood supply to the tumor could not grow. So by modulating endocannabinoids, you can actually change angiogenesis and blood supply to the tumor, and she's doing it more specifically by using nanomedicine, and she will describe to you in details her work. Dr. Adi Aran, who is the director of the neuropediatric unit in Shaarei Tzedek Medical Center, which is affiliated with the Hebrew University, is also here with us, and he's a leader in the role of cannabis and endocannabinoids in autism spectrum disorder. As you may know, in autism spectrum disorder, disruptive behavior is a major health problem, and Dr. Aran will give you a large overview of the journey from starting from animal models of autistic spectrum disorder to throughout the first observational studies in children, and take you to the first conducted controlled study in ASD that is being done in Israel and no other place in the world. So you will hear more about that tomorrow. And tomorrow, I will take the lead again, and now with a different hat, not the director of the center, but the head of the obesity and metabolism laboratory. And our focus is to try to uncover the involvement of cannabinoids and endocannabinoid system in metabolic diseases, in different metabolic diseases. And I will briefly and more thoroughly introduce to you the fact that you can manipulate your body to fight obesity, fatty liver disease, chronic kidney disease, and that are associated with both obesity and diabetes. And with that, for the first time here in Argentina, I think it's a nice coming of the Hebrew University representative to deliver some and disseminate some of our research that is done in the field, and I hope that in the next year we will be able to come again and bring with you more knowledge with us. And I would like to finish my presentation by that we always need to look back in time to the extensive work that has been done in Israel by Professor Rafi Meshulam, who is the father of cannabis. But we also need to look ahead, to look what we would like to achieve in the future. And we are still in the beginning. Thank you so much. Effects contributing to the secondary effect of the brain injury, and she will show you how you can manipulate either the plant or use the plant or manipulate the endocannabinoid system in order to get therapeutic benefits to treat traumatic brain injury. Next, Professor Rami Yaka is also here with us. He is the head of Lab of Addiction and Neuroscience, and his work is trying to understand the molecular mechanisms that underlie drug addiction such as cocaine and cannabis, and develop new therapeutic to prevent it. As you may know or may not, the drug addiction consists 3 different stages, starting from the acute use of the drug to the social and compulsive use part, and then during the withdrawal effect of the social and compulsive aspect of drug addiction, there is increase in the capability of relapse. And we still don't know exactly what triggers the relapse for cannabis addiction. And he will briefly and more thoroughly describe to you the role of endocannabinoids and the use of the plant to modulate this specific activity. Dr. Ofra Beni, who could not do the travel due to personal issue, will deliver a talk tomorrow through a web seminar. And she is the head of the lab of nanomedicine and tumor microenvironment. Her research is to try to develop a drug and drug delivery system for cannabinoids to treat cancer. And more specifically, she will show you how important it is to target the blood vessels that are surrounding tumors, because this, without blood supply to the tumor could not grow. So by modulating endocannabinoids, you can actually change angiogenesis and blood supply to the tumor, and she's doing it more specifically by using nanomedicine, and she will describe to you in details her work. Dr. Adi Aran, who is the director of the neuropediatric unit in Shaarei Tzedek Medical Center, which is affiliated with the Hebrew University, is also here with us, and he's a leader in the role of cannabis and endocannabinoids in autism spectrum disorder. As you may know, in autism spectrum disorder, disruptive behavior is a major health problem, and Dr. Aran will give you a large overview of the journey from starting from animal models of autistic spectrum disorder to throughout the first observational studies in children, and take you to the first conducted controlled study in ASD that is being done in Israel and no other place in the world. So you will hear more about that tomorrow. And tomorrow I will take the lead again, and now with a different hat, not the director of the center, but the head of the obesity and metabolism laboratory. And our focus is to try to uncover the involvement of cannabinoids and endocannabinoid system in metabolic diseases, in different metabolic diseases. And I will briefly and more thoroughly introduce to you the fact that you can manipulate your body to fight obesity, fatty liver disease, chronic kidney disease, and that are associated with both obesity and diabetes. And with that, for the first time here in Argentina, I think it's a nice coming of the Hebrew University representative to deliver some and disseminate some of our research that is done in the field, and I hope that in the next year we will be able to come again and bring with you more knowledge with us. And I would like to finish my presentation by that we always need to look back in time to the extensive work that has been done in Israel by Professor Rafi Meshulam, who is the father of cannabis. But we also need to look ahead, to look what we would like to achieve in the future. And we are still in the beginning. Thank you so much.